Hi, I'm Enchanting Nubianette. Welcome back. And if you're new to my channel, welcome. Now, did you know that Bill Gates, he has started an 8-year IUD and he's focused on Africa. Once again, Africa, not the United States where he was born and raised. So, the Bill and Melinda Gates Foundation is introducing a new hormonal IUD in several African countries. So, IUD is an intrauterine device. And we know that many women here in the United States and other parts of the country have used, this device when preventing themselves from, becoming pregnant. So let's continue. This IUD is focused on African countries such as Kenya and Nigeria, even India. It's designed to prevent pregnancy for up to, listen to this, 8 years, making it the first of its kind in the world. So the foundation aims to expand access to family planning and so-called empower women with more control over their reproductive health. So this is an 8-year hormonal IUD. It offers long-term solution, as I mentioned, and it minimizes the need for frequent clinic visits. So because this is something new, honestly, I would say that the women should have more frequent clinic visits to see if there's any side effects and how it's processing in their bodies because, one invention or one device like this will react differently in people's bodies depending on their body chemistry, their blood type, their diet, age, and so on. So the IUD rollout is a part of the Gates Foundation to expand family planning and improve reproductive health services in developing countries. So while the initiative is focused on individual empowerment, it also acknowledges a potential impact on population growth. That's the thing, everyone. We know that Africa has, I believe, 54 countries. It's vast. It's about 3 times larger than the United States. And in my perspective, I would say that this is another tactic for decreasing the population, especially of melanated people, African people, because why isn't Bill Gates starting this in the United States or even, okay, developing countries? There are many developing countries, even in Europe. We have Eastern Europe where we have several developing countries that need resources and need help, and even to assist, women with empowerment as well. Why is it focused on Africa? So I'm going to now focus on the side effects, long-term side effects of IUD usage. Excuse me. So according to online reports, IUD use can be both hormonal and non-hormonal, and it definitely can lead to changes in the menstrual periods. For example, women have been known to have light and absent periods. Many women do, love this um, side effect because they don't have to have the cramping issues. They don't have to, have a change of clothing or, of course, buy extra pads and other, items so they can monitor their menstrual period. So that's one factor that can be a plus for many women. In a few months, it says initial irregular bleeding is common in the first few months after the insertion, and usually it's inserted in a woman from many for several months, and it's usually checked by the doctor. Usually, in the past, women would go to, the doctor to remove it and then replace it and so on. I've never had one, but I know from people I've known in the past that they've had to, check it. Sometimes there's a little defect, they have to replace it. Regarding menopause, hormonal IUDs can make it more difficult to track menstrual changes related to perimenopause and menopause. So, blood tests will be needed in order to track. After removal, one's period, so for example, if you're planning on having children, your period will take a few months to return to normal after a hormonal IUD is removed. Because the uterine lining also needs time to build. To remember, all the changes in the body that is occurring year after year, and this is an 8-year IUD. It's not the regular as we've had before, where women probably had it for maybe a year, um, or maybe two, or maybe, women have started using it in their, teenage years, maybe 16 or 17 and onwards, until they, become married or they have a partner and they want to have children. So in the non-hormonal, the copper IUDs, some women have experienced heavier and longer periods, especially in the first year. So it's like definitely a flip or a switch, completely opposite. And these heavier and longer periods can persist long term, which again, you're going to need, more padding and even change of clothes. And you have to continually check yourself when you go to the restroom and so on. And for example, the concern will come about if a period is missed, and a pregnancy test definitely should be taken. So, of course, if someone is taking this type of hormonal IUD, if you do become pregnant, you want to check, because you don't want to cause harm to the fetus. And depending on the stage of pregnancy, so if a woman were to get her menstrual cycle or become pregnant, definitely you need to check with your doctor right away, because there may be harm to the baby, which no one wants. Definitely to consult a doctor if there's any concerns. And in this case, where it's an 8-year device, I definitely have to say I looked online to see if there was a trial period, because as you know, the medicines that are on the market and have been approved by the FDA, the Food and Drug Administration, they must go through a trial period. Usually it's well over a year, even sometimes 4 years, because they want to test people who are healthy. A lot of healthy participants will have the drug or the medication to see how it affects the body, and people who have the illness. So, according to online reports, there is no reliable source indicating that this device has undergone and completed an 8-year clinical trial. So, it says the news is about its planned availability and design life. That's what the news focus on, how it's available for people to utilize it. It also says there's a separate project, the MIT Depot Injection, funded by the Gates Foundation. It has been allegedly tested in rats for 3 months, with researchers projecting that it could potentially last more than a year. But the human trials in any duration beyond rat studies are not yet confirmed. So yes, before these medication or drugs are available, they are tested, as you may know already, with rats and then humans. And there are several research programs where they had the clinical trials and it's tested first on humans, and that's where they learn about the side effects, how it affects people, different ages, again, your blood type, your gender, um, so on and so forth. So I really hesitant, for example, for myself, I would not take this, anything that is made by Bill Gates, especially that he's focused on Africa and it's an 8-year IUD. Why not start with an IUD that's, maybe 4 years? So, what do you think about the Bill Gates Foundation launching the world's first hormonal IUD that lasts for so long? Some people may say it's innovative, and yes, it can prevent pregnancy. But why is Bill Gates so focused on birth control in Africa? Do you trust Bill Gates? Do you think this is progressive? Do you think it's beneficial for women? Is it really empowering women? Because honestly, I've read articles several years ago where women in some parts of Africa, not with Bill Gates, with another company that was around during the 2020 period, that made billions of dollars during the 2020 period. Decades ago, they gave medication to many women in Africa. Those women lost their children. Many of them were never able to conceive children again. And allegedly, many of the children had brain damage. So please read the articles for yourself, do your research as well. I just wanted to give you this information. Okay, I would love to hear your feedback. Thank you for watching, and please like, share, and subscribe to my channel. Stay safe and have a wonderful day.